Hello, Facebook viewers. I welcome you all for yet another Health Talk series on this Awareness Day. Today is 12th November, which is considered as World Pneumonia Day. I take this opportunity to welcome the Honorable Speaker of the Day, Dr. Prabhakaran Sir. So he is heading the Department of Naturopathy. He has completed his MD in Naturopathy and he has more than 10 years of experience in this world. He is an assistant professor in JSS INYS. So he will be briefing us about pneumonia and its prevention through naturopathy and yoga. Over to you, sir.
Thank you. Good morning to all. So today is a World Pneumonia Day. That is 12th November. So we are going to see about how to manage pneumonia with naturopathy and yoga management. So we go to the slides. Next one. So pneumonia, as you all know, it's an acute respiratory illness. So pneumonia, Sir William Osler, great lecturer, had said that the captain of the men of death and the old man's friend is pneumonia. So pneumonia is mostly seen in the young age people and old age people. Next. Photo of the killer slides. So history, when we see about the World Pneumonia Day, when it comes to being we can say campaigning starts from 2009. So it was first observed on 2009 under the Stop Pneumonia initiatives by Global Coalition against child pneumonia. So it was the first time they started. They wanted to bring so they want to bring awareness on pneumonia to the world. So it started on 12th November 2009, and from that year, every year it is celebrated. And next, it changes, slide changes. So World Pneumonia Day this year, 2024 theme is Every Breath Counts. Stop pneumonia in its track. So as early as we find the pneumonia, we have to stop and rectify from it. So the theme highlights the significance of every breath and underscores the urgency of stopping pneumonia through early detection, treatment, and prevention. So while seeing the last 5 years theme about pneumonia is in 23, it is about campaigning the fight to stop pneumonia. In 22, pneumonia affects everyone. 21, stop pneumonia, every breath counts. And 2020, let's increase across access to the medical clinic. Okay, next. Medical oxygen. So oxygen it is related with it. So next, facts about pneumonia. If you see the facts, pneumonia is a contagious disease that can spread through coughing and sneezing and through fluids such as blood during childbirth and infectious agent like bacteria, virus, and fungi. Then main agents, if you see, Streptococcus pneumonia and Haemophilus pneumonia type B and respiratory syncytial virus. Syncytial virus is the most common of viral pneumonia. Next. So next, according to WHO, 14 lakh children under the age of 5 dies every year due to pneumonia and accounting for 18% of the death of children under 5 years old. And UNICEF had said that every 39 seconds a child dies of pneumonia. So the risk factor affecting pneumococcal pneumonia is 65 years with COPD in 7.7 times higher than a healthy one. And then those of asthma are at 5.9 times greater risk. So it is a higher pneumonia infection is higher in COPD than asthma. And it is estimated that 16 lakh pneumonia deaths among the adult aged over 50 are attributed for air pollution and smoking. Next. So the aim of World Pneumonia Day is every breath counts, the coalition in the world first public-private partnership to support national government to pneumonia deaths by 2030, it has to end the pneumonial death. And in 2013, WHO and UNICEF launched an integrated global action plan for prevention and control of pneumonia and diarrhea with the aim to reduce pneumonia child mortality to less than 3 child pneumonia death per 1,000 live births in every country by 2025. So it is about to plan the when it was planned in 2003, it is about to achieve by 2025, that is the next year. Next. So pneumonia. So we are going to see about some general things about pneumonia. So it is a respiratory illness associated with recently developed radiological pulmonary shadowing, which may be a segmental lobar or multi-lobar. So pneumonia and pneumonitis are always go related, but a solidification will be seen in the pneumonia condition. So inflammation is the lung characterized by accumulation of secretion and inflammatory cells in alveolar. So it is an acute inflammatory condition. Next. So if you see, pneumonia remains the common cause of death, and it is ranked 6th, and community acquired pneumonia, that is CAP, is the most common cause of severe sepsis. And despite introduction of antibiotics, imaging modalities, and biomarker testing, mortalities related to CAP has not changed significantly. Next. So if you see the clinical types, CAP and hospital acquired pneumonia, HAP, then suppurative and aspiration pneumonia, and pneumonia in immunocompromised patients are the classification of types. Next. So the anatomically, there is a classification called lobar pneumonia and bronchopneumonia. So it is both are involved, lobar and broncho. Next. So pathogenesis, if you see the pathogenesis, congestion, then red hepatization and gray hepatization and resolution. In congestion, the presence of proteinaceous exudate that often of bacteria in the alveoli. So it causes the congestion. Then hepatization, the erythrocytes in the cellular intravascular exudates, and neutrophils are also present. Then bacteria are occasionally seen in cultures of alveolar specimen and in collections. Then gray hepatization, no new erythrocytes are extravasing, and those already present have been lysed and degraded. The neutrophil is then predominant in the cell, then fibrin deposition is abandoned and bacteria have been disappeared, and correspondence with successful containment of infection and improvement in gas exchange. And resolution, the macrophage is the dominant cell type in the alveolar space, and debris of neutrophils, bacteria, and fibrin have been cleared. Next. So mostly if you see that summary of it, the congestion will be a vasodilatation, and red hepatization will be exudation with RBCs, and gray with neutrophils and macrophages, and resolution, the new macrophages will be removed and normal. So symptoms, if you see, the patient will have high-grade fever, cough, productive, and pleuritic chest pain and breathlessness. Some additional will be sharp stabbing chest pain, headache, excessive sweating and clammy skin, then loss of appetite, fatigue, confusion, especially in older people. Next. So general signs, febrile, tachyphonia and tachycardia, cyanosis, then hypotension, then altered sensorium, then uses of accessories, muscles of respiration, and confusion in advanced cases. It may also go to coma in some cases. Convulsion and coma will be there. Next. So signs of consolidation. So the consolidation is the main thing differentiates from pneumonia and other COPDs. So percussion, dull, there will be dull percussion, then bronchial breath sound, then fractals will be heard, then increased VF and VR, then ageophony and whisperizing, pectorally, and pleural rub will be there. Next. So now we are going to see about the management of pneumonia through naturopathy and yoga. So the naturopathy, if you see, the main aim of naturopathy and yoga is to eliminate the things which is built, which causes or which is affecting the factor. So elimination is our main aim, and we have to improve the elimination through the 4 main organs, that is our lungs, skin, then kidney, and through bowels. So these are the four main channels of elimination according to the naturopathy. So when these are affected, the disease will be inside and it will be started to spread. Whenever we are taking medicines or anything, we are suppressing the thing. So one of the cause, if you see, means there is also drug related which cause the pneumonia and some gas related also. When we are in, as we see in the old age cases, some cases, inhalation of air pollution through dangerous gases also causes pneumonial infection and pneumonia is there. So yoga and naturopathy aim. So we have to eliminate the thing and we have to restore the functions. So the aim of treatment, as we also we know, it is acute inflammation. So acute disease. So according to naturopathy, we say acute disease is a remedial process which itself helps in treating our body. So the main aim of the acute disease, we have to let it eliminate thoroughly. So improve the elimination is the main thing, and then we have to restore the vitals. So as we see, the pulse will be high, then the patient's breathing will be, that is the respiration rate will be more than 30 per minute, then the temperature will be more high than nearly to 105, 106 in some conditions. So these are the vitals which will be high. So we have to reduce and make it low down. So acute disease, when we see acute disease is as said, it is a remedial process. So we have to clear it from the body. So we should not take any drug which suppress the thing. And so suppressing causes the disease to the next level. So then it may change to a chronic level, and in some cases, it may also bring a fatal changeover. Next. So if we see the treatments, there are many treatments in hydrotherapy. So in hydrotherapy, we can give a warm trunk bath, then spinal bath, hot foot bath, then cooling bath, then dully wrapped packs, then pack and wet application to trunk, enema, and mud application to abdomen. So these are the treatments which we use in hydrotherapy. So warm trunk bath, which is nothing but we can give it as a spinal bath or in an immersion thing, we can give it. So the patient has to be given 2 times a bath in the early stage when we are finding. So the treatment plan will be nearly about to 10 to 2 weeks, 10 days to 2 weeks. So it will improve the thing and clear the sputum or mucus or catral in the body. So it will help to eliminate and clear the lung. So it is due to the consultation, the space will be, it will take the pleural space. So air will be filled and the proper breathing will not be there. There will be a difficulty in breathing, sometimes stabbing pain in the breathing thing. So warm bath helps as a vasodilation. So it helps in dilating the lung, helps in improving the breathes, everything. So we can do warm bath along with hot foot bath. Hot foot bath along with arm bath, it also relieves the congestion in the chest region. So it helps to relieve the congestion and improve the circulation. Then cooling bath is just to make the reaction, that is make the action to a longer phase. When we are giving the warm trunk bath and hot foot bath, the cooling bath, which is given in a short duration, will help to prolong the action of the before given baths, that is the hot bath and warm trunk bath. Then dully wrapped will be, warmness will be given. So wet wrap will help the patient to keep themselves in warm condition so that the breathing will not be affected. So there will be a easy breathing and there will be also a bronchodilation will be there. So it helps to make the expectorant phase or expectorant action so that the sputum or the mucus which is there will be expelled. Then packs, mainly wet pack can be given to the trunk. So it helps in the both vasodilatation. So the face will have also vasoconstriction, then vasodilatation. So it will improve the functioning of the lung into a normal condition. Enema should be given. In some cases, there will be constipation. So taking a warm water enema will help to relieve the constipation and also eliminate the any infection, any things or any toxin matters through the bowels. Then mud pack to the abdomen, it also helps in reducing the temperature and also helps to improve the digestion and also helps in improving the vitality. So if you give all this hydrotherapy treatment, the patient with more than 105 degree of temperature, Fahrenheit of temperature will be reduced slowly and in a good process. But we should not stop this treatment. We should continue the treatment for more than 5 to 8 days. At least a week time, we have to give it continuously. Even it can be extended to up to 14 days. In some young children, that is in infantile condition, we can also give a cold air bath to the face, exposure to the face. So it helps them for the improving the breathing and everything. So continuing this helps in making down the temperature. So the treatment could be given in an equal phase. So we have to give at least twice a day minimum in the evening, in the morning and the evening session. So it makes the patient to be in a free manner. Otherwise the pain, in some cases there will be a shoot up in headache. So it also helps to reduce the hot foot bath and arm bath, helps the headache condition and everything. Next. So if you see the diet, diet is our main thing because in naturopathy we say diet is the cause and also the cure for the disease. Whenever we are in a wrong diet, it causes the disease, and whenever we are in right diet, it helps us to relieve or free us from the disease. So diet majorly improves the immunity in our body. So whenever we are having more, we can say, even in nutritional status, they are telling that a patient should be in juices, mainly of nutritive juices, so that it helps them to keep an energetic. And mainly fruit juice and vegetable juices are given in this condition. Fruit may be mostly of acidic, like orange, lemon, Mozambique, then pineapple, grapes can be given as a fruit juice. So this juice helps us to be, as bromelain in pineapple helps to be a bronchodilator, and even resveratrol in grapes helps to be eliminative one, and it also residues area with triggers anything in the lung, and it also helps, and it is also a bronchodilator. Then other thing also helps as a bronchodilator. In lemon, along with honey, improves the breathing and also helps to expel the sputum from our body. Then the patient can be given a rice gruel, so it will help him to soothing. First, for 4 to 5 days, we have to keep the patient like a juice fasting, so that it eliminates all the impurities from the body, and it also gives an increase in immunity, which fights against the inflammatory condition in our body. The body produces its own immunity, so that we can be free from it. So 4 to 5 days, it should be of fruit juices, and then our vegetable juices. Vegetable juices like carrot and tomato can be given. Then rice gruel, if you see, means like in Tamil we say kanji. So the rice kanji, a hot thing. Only water can be given for first 2 days. Then we can add a little rice with a porridge manner along with this gruel we can give. Then cooked vegetables after 8 to 10 days we can add the diet to the patient. Then whole wheat roti. Roti, as it is a presence of heatness in the food. So it being bronchodilator, it helps for the easy breathing also. So these kind of diet, it's like a fasting. It's like a one phase of fasting also. So eliminating, and then we are soothing, and then we are constructing the patient's health. So while following this, there will be a good improvement within 3 or not 3, within 2 or 3 weeks we can see. So it also helps to clear the thing. So there are many old naturopaths who followed a strict diet and these naturopathy treatments to improve and clear the pneumonia patient. There is a double pneumonia case for a 16-year-old, which was treated by Lakshman Sharma's student, and it was said by him, and he was in contact with Lakshman Sharma, and he has treated his own daughter, it seems. So she was having two double pneumonia. These facts and thing, following it alternatively 2 times a day, 3 times a day, with also with mud packs, sometimes mud pack to the mud application to the chest also with little hot water. So it helps us. Then they are given hot fermentation. It is also a good thing. So along with this, they had given fruit juices. So it helps the patient. Once the temperature didn't go beyond 105, they were reduced to 102, and it was barely 105, 102 in a shifting manner between for 7 to 8 days. And after the 10th day, the girl had a regurgitation and she expelled the sputum around 10 ounces. It came out. So it was a good case and we can treat it here. Next. So some natural remedies is also there. Before seeing natural remedies, there are some yoga. So yoga, we have to improve the lung expansion exercise will be a good thing, like Gomukhasan, then hand stretch breathing exercise, then Skanda Chakrasana, which also helps in expansion of the chest. Then we can give Bhujangasana. So these asanas will help, and also we can go with Pawan Muktasan series 1. So anything which makes our active also helps to be inactive. So breathing, we can't force the breathing, but it should be a normal one. So without pranayama, we can do these kind of exercise. We can make the patient lie in a savasana with normal breathing, which helps in. And we can also ask the patient to lie in makrasana, that is a supine prone position. So it is also helps in draining the lymphatic drainage, helps in draining the limbs. Lymphatic drainage will be improved, and so it will help in these cases. The natural remedies, if you see, sesame seed mixed with flax seed and a pinch of sesame seed, that is till seeds, 1 tablespoon, along with flax seed 1 tablespoon, and a pinch of salt. It may be a mountain salt or red salt or black salt, along with raw honey. And when we give this to the patient continuously for 2 weeks, it removes the catral matter and phlegm from the bronchial tubes. It helps to expel the phlegm from the body. Next is about the garlic. Garlic is a good one. Along with ginger also we can take garlic. So garlic brings down the temperature, pulse and respiration to normal. So we need to take a sufficient amount, around 4 to 5 cloves of garlic. That is the small one we can take. And also garlic juice. Garlic juice can be also applied to the external to the chest. So it can be applied in the chest, and it results as an irritant and rubefacient. So it improves the breathing and also keep the patient in a warm condition. So it helps to expel this too helps to expel the phlegm from the body, from the chest region and broncho region. Then turpentine oil can also be used as a massage, and it can be used to rub in the rib region, and it also we have to do a pack like thing so that it helps and acts as an expectorant. Next. So there are some quotes for the pneumonia. So pneumonia, the main thing is to teach the patient about how to be awareness, and about we have to also make them prevent from pneumonia. As it is an infection, it can be easily spread from people to people. And the main thing, if you see, it is a CAP, that is community acquired pneumonia and hospital acquired pneumonia. So whenever the patient has to go to hospital or anything, they have to be good. Another thing about diet, there are many things. We have to be very much conscious about what are the things not to be taken. So anything which is high in sugar, then unrefined foods, refined food products like maida products and bakery items should be avoided, and mainly tea, coffee should be thoroughly avoided. So these are the things which harms us. So whenever we are feeling any, not only pneumonia, in any COPD condition, these things if we are avoiding and we take intake of more of fruit juices and vegetable juices makes us to be healthy. So these quotes like breathe in awareness, breathe out pneumonia grip, lungs unite, voice ignites, World Pneumonia Day, and also inhale hope and exhale pneumonia. So join the fight and vaccinate for breathe. So vaccination is also one of the things what allopathy doctors or modern medicine doctors use. So respire the knowledge, combat pneumonia's impact, then healthy lungs, thriving lives. So healthy lungs health comes in the doing yoga, not only asanas but also breathing techniques. So we should aware of it and we should have it done under a proper guidance under any naturopathy doctor. Then next happens. So prevention measures, if we see general things about prevention measure is vaccination, then good hygiene. We should have, as we all know, during the COVID times, and many times we have seen that hygiene, mainly of hand wash, is a regular thing. So regularly with soap or any sanitizers or any other soap or water. Then avoid smoking. Smoking is also a main cause for these disease. So smoking, then alcohol should also be avoided. Then healthy diet and exercise is a great thing. So diet and exercise makes the proper functioning of the body. So it also helps in the proper taking the energy, the nutrition. Whenever by doing healthy exercise, taking healthy diet and exercise, it will have a proper difference between the drainage and the intake of nutrition to the body. So without any hungry, whenever we are taking a good diet also, whenever our body is not in a good condition, that is not in a healthy thing, that is mainly our basal metabolic rate should be in a good proper manner. So exercise helps us to keep our body in a good way. So whenever we are taking a healthy food without any hunger also, it causes disease. So exercise and diet are the main things. Then avoid sick contacts. So limit exposure to people with respiratory infection. So whenever taking a healthy diet will also boost our immune system, and also we should take foods mainly of green leafy vegetables and fruits and vegetables, which helps to improve our immune system, and also the spices and condiments mainly of pepper, garlic, then ginger, everything. This food helps to boost our immunity, and vitamin C is an anti-inflammatory thing. So taking of more of this will help us. Then avoid sick contacts, then manage chronic conditions. So like asthma, COPD, and diabetes should be under control, and also increase the, when it is not under the control, it increases pneumonia risk also. Then practice respiratory etiquette. So cover the mouth as we used as followed in during the COVID-19. So use a mask while going outside, and also while coughing or sneezing, try to cover it. Then adequate sleep is a good thing to improve our immune system and as well as vitality. Vitality, which is the life force, while doing proper exercise and having a good sun bath and proper nourishing helps to keep the vitality. And main thing is to get a good proper rest. So rest is a good main thing to improve our vitality. Without giving a proper rest, our body will not have a improved vitality, and slowly the vital energy will be reducing as like a battery in a mobile phone, so that as a some limit, so the limit should be followed properly. So overusing can also decreases the vitality, which inversely affects the immunity. So stay good and follow this prevention measures. Thank you.
Thank you, sir. On behalf of all the viewers, I extend my wholehearted gratitude to you, sir, for your time and effort for showering us with your knowledge. I would also like to thank our management who have always been supportive for our initiative and encouraging us to strive for excellence. So I request all the viewers to stay tuned for our upcoming Health Talk series. Thank you.